Osteoporosis. Osteoporosis. Osteoporosis is defined as a condition in which density of bone is reduced, which causes architectural deterioration of bone tissue. So basically, reduction in bone density. Reduction in bone density. And due to reduction in bone density, it causes architectural deterioration in bone tissues. Deterioration in bone tissues. It may result as a complication of musculoskeletal disease. So what is its etiology? It may be endocrine origin. In case of hyperparathyroidism, osteoporosis may develop. Hyperthyroidism, hypogonadism, because estrogen is directly related with osteoporosis formation. So hypogonadism. Next, it may drug induced. It may cause by corticosteroids, sedatives, anticonvulsant drugs, etc. So drug induced. Rheumatoid arthritis, ankylosing spondylitis. So these are the basic etiology. And since there is deterioration in bone tissues, it leads to fracture. It leads to fracture. Now next is clinical feature. Clinical feature of osteoporosis. It is asymptomatic until fracture appears. Asymptomatic until fracture appears. Until fracture appears. Back pain, height loss, spine becomes curved, so height loss, and worse by movement. In case of osteoporosis, symptoms worse by movement, while in case of ankylosing spondylitis, symptoms relief by movement. This is the basic difference between osteoporosis and ankylosing spondylitis regarding with its relief and its aggravation. This is the basic clinical feature of osteoporosis. Next is investigation. DEXA scan is one of an important investigation. Dual energy. D stands for dual, E stands for energy, X, X-rays. A stands for absorptiometry. Absorptiometry. So DEXA scan is one of the important investigation of osteoporosis at LS joint and hip joints, lumbosacral joints and hip joints. Next is management and treatment of osteoporosis. So the main objective of management is relieving symptoms, by any means. And for relieving symptoms, exercise is very useful. Calcium rich diet is recommended. Calcium rich diet. Physical activity. Physical activity is needed to improve osteoporosis. And as far as treatment is concerned, bisphosphonates are given in empty stomach. Bisphosphonates. Drugs are given in empty stomach, and basically these drugs inhibits bone resorption. So next is calcitonin, but calcitonin is given in case of menopausal osteoporosis. So one of the treatment is calcitonin drugs. So this is all about osteoporosis. What is osteoporosis? What is its etiology? What is clinical feature? And what is investigation and management as well as treatment? And this is very important topic. And I will proceed in my next lecture.